We're from USC and we're currently taking nutrition and dietetics, and we would like to ask if you want to have an interview.
Okay, you're most welcome.
About hypertension in order to complete our requirement in healthcare.
Sure.
Ano po, I'm Erica Buenafe po. I'm Angel Amiray. I'm Rosel Custodio.
I'm Kenji Franco po.
And I'm Lily Cortez.
And I'm Dr. Las.
Okay.
Makati Med.
When I got your text, I thought, kaya I asked, sabi ko, college ka na ba? Wala ka sa Katrina. Yung pa, ngayon sabi ko, ay, Erica nga pala nakalay. So you're taking up nutrition?
Apo.
All of you?
Yes, sir.
Anong school? Sa BST. Oh. Wow, mga pre-med pala. What are your questions?
How do you define po hypertension?
That's your question.
First question.
First question. Hypertension is defined as having a blood pressure of more than 140 systolic blood pressure and a diastolic pressure above 90 millimeters mercury. So it is a disease of the arteries, and that the normal blood pressure is anything lower than that. So if your BP is above 140 and systolic and above 90 diastolic, considered hypertensive.
So ano po yung factors that may lead to hypertension?
90, well, out of 100%, most likely, more than 90% of hypertensive patients are familial in origin, meaning there's a genetic predisposition. So it's not really a lifestyle disease. No? You were born to have hypertension at a certain point in your life, for those who are predisposed. So 90% of the people, of hypertensive people, have that characteristic. At a certain age, usually middle age, you will start having problems with BP, and this will be lifetime. No, the remaining 10% fall under the category of secondary hypertension, meaning there's a cause, either a kidney disease, a tumor, an endocrine disease. Endocrine is yung mga metabolic disorders like thyroid problem, no? But mostly, the general population, we call it essential hypertension, genetic. You get something from your mom, something from your dad, and then you develop this. So,
Sir, what do you advise your patients po about in hypertension, the treatment?
well, when you are diagnosed with hypertension, like I said, your BP is taken to be more than 140/90. There are several ways of treatment. No? There is the non-pharmacologic way and the pharmacologic way. No? And usually you have to incorporate both. Very seldom does one work alone. The non-pharmacologic way is you have to maintain your ideal body weight. No? So hindi pwede yung obese, hindi pwede yung overweight. You have to have a regular aerobic exercise. They say that all of these factors will lower your blood pressure about anywhere from 3 millimeters to 7 millimeters. Nakakatulong. Another thing is you have to avoid salt. No? In terms of nutrition, they say less than 4 grams a day of salt will lower your blood pressure. Stress, limit your stress. Try to avoid too much alcohol and smoking. And then the pharmacologic treatment, you have to take medicines. There are several classes of medicines to choose from. Normally, once you start on them and they work for you, you continue taking them for life.
Sir, what is the usual age group that usually have hypertension?
The majority of the patients start developing hypertension at middle age, so around 40 years old. No, they say when we see a patient in this age group, we normally believe that this is essential or the primary kind, genetic kind. Now, if you develop hypertension at a very young age, like 20 years old, or a very old age like 70 years old, then it's probably from another cause, no? So you might have some other problem. But the 90% essential hypertension, blood pressure problems usually are detected at between 35 to 45 years old.
Sir, what can you say to those hypertensive that only take their medication whenever they feel that they are having the attack?
That is wrong. Definitely wrong. No? First of all, people say in the local language na hina-high blood ako. No? You always hear that. Parents, relatives, neighbors. Hina-high blood ako meaning mainit ang ulo, masakit ang batok. That's not really a good term because in fact, more than 90%, again, that number is very common in blood pressure. 90 yung abnormal, 90 rin yung essential, 90 rin yung percent of hypertensive patients are asymptomatic. You don't feel anything. So you cannot really say na hina-high blood ako because you don't feel anything. You only detect it when you go for your physical, annual, or you have this mga executive checkups. No? And once you start taking it, once you're diagnosed, the recommendation is to continue taking it tuloy-tuloy. If you don't take your medicines regularly, we have a term for that, you're non-compliant, then you will end up having fluctuations. Minsan mataas, minsan mababa. Even without taking your BP, it will be that way. And the studies have shown that the rate of deterioration is the same as yung walang gamot. Pareho lang yun. So, not a good idea to just take when you feel something because you might not be feeling something and yet your BP is still high.
So is it possible that hypertension may lead to other diseases?
That is exactly the reason why we treat it. No, hypertension alone will not kill you. No, but hypertension is involved in so many diseases. It's like a major risk factor in developing heart disease, especially the coronary heart disease, strokes, kidney disease, peripheral arterial disease, blindness. No, so yun yung mga long-term effects na those maybe you can limit it to those 5: heart disease, brain disease or strokes, peripheral arterial disease, problems sa legs, the kidney disease, masisira din because of the high pressure, masisira yung kidneys, and eye problems.
Or to summarize all of this now, what can you advise for us nutritionists that work together with the doctor in terms of the diet of the patient with hypertension?
Oh, well, yun. In terms of hypertension alone, you have to limit the salt intake. No, try to keep the patient on a balanced diet so that he or she will not gain additional weight. And again, the salt is very important. No, for how do we say this? The misconception is that cholesterol is somehow related to hypertension, fatty foods and that. It's another totally different disease, you know. Cholesterol is controlled in patients with cholesterol problems. With BP problems, you control the salt. So, try to come up with a diet that is low in salt. Also, caffeine increases your heart rate, it can increase your blood pressure. Alcohol can increase the blood pressure. So those are the things that you should try to tell your nutrition people. Avoid caffeine, avoid things that can make your heart rate go fast. Avoid alcohol or limit your alcohol. And limit your salt.
So thank you po.
Thank you,
very
sir.
much
Oh, that's okay. Weekly lang pala.
Opo. Sorry po if we're late. So we have
No.
simple token of appreciation.
No, it's okay. You give that to Yolanda.
Hindi po perishable item po kasi.
Okay.
Kaya kailangan na ito.
Dalawa.
Insight ko po.
Thank you.
Thank you very much po.
Unfortunately, I cannot get a patient for you. Ano kasi medyo
Okay,
late
sir.
na.
Okay lang po.
Interview your parents.
Thank you, sir.
Okay?
Thank you po, sir.
So you're going home? Okay na.
Yes.